Our next speaker is Alan Cottenden, and Alan Cottenden will be known to many of us. I'd like to acknowledge Samvata's support for his involvement in bringing Alan to the conference. Alan's a Professor of Incontinence Technology in the Department of Medical Physics and Bioengineering. He's Professor and Chair of the Organising Committee for the world's only two conferences on incontinence technology. The biennial conference, the Engineering Challenges Series, run in London by the Engineering in Medicine and Health Division of the Institution of Mechanical Engineers, and Innovating for Continence Series, also biennial, run by the Simon Foundation, people to be aware of, in Chicago. He's contributed to all 4 WHO international consultations on incontinence, leading the team which introduced a chapter specifically on incontinence technologies in the 2004 and the 2008 editions. And Alan will be talking to us today on evidence-based guidelines for the selection and use of continence management products. I'd like to welcome Alan to the podium.
Well, thank you, Michael. I'm delighted to be here to meet you all. I must say that I'm used to opening up interesting packages and finding what's inside, and it took a lot of control not to rip open Christine's box, which has some very interesting things written on the side. We're used to referring to incontinence obliquely, aren't we? There's authentic, there's all sorts of words on there that don't tell us anything, actually. So I want to help you open that, please, at the break. So this is what I'm charged with talking to you about. What is our evidence base for making sense of the really rather bewildering plethora of incontinence products that are available on the market? And I'm going to base what I say on the international consultations on incontinence. The 4th one happened a few years ago. The 5th one is just happening now, and the focus conference on it will be early next year, and that will result in a revised book in a while. But I'm going to start there with reviewing the data that we have. Just acknowledge that this is a team sport. I also want to acknowledge that this chapter came out of vision from David Fonda, who's here somewhere or other. David headed up for some years the chapter in this consultation on care of frail elderly, and suggested that there really ought to be a chapter looking at management with continence products. So actually this all grew out of him seeing a need there, and there's been Australian involvement with that all the way through with each of the groups that we've worked with. So this was our brief to look at this variety of products, and when I started to pull together some slides, I thought there's no way that I can touch on all of this, and what I've decided to do is to actually limit down just to urinary incontinence. So sorry, Chris, disappointment there. And I'm going to look at those products there. I'm going to exclude catheters simply because there's a very large and specialised literature there that's been well covered in all sorts of reviews. I'm going to cover the topics here which tend to have less literature on them. But if you want to know about the things I'm not covering, they are, of course, all mentioned in the book that you can download free from the ICS website. You perhaps know you can pull it down for free from there. So what are we going to do? Just to remind ourselves that although we would like to cure all people with incontinence, that's not always possible. And so the products that I'm talking about have a very important role to play where we can't fully cure, where people are waiting for treatment, treatment's unavailable and so on. And sometimes people say no thank you to the treatment that's on offer. And that's fair enough if that's an informed choice. And in all of those cases, really, the focus becomes what can we do to enhance the quality of life, maximise the quality of life of people whose incontinence can't be fully cured. Why is it important that we have an evidence base for our product selection? Why is that important? Well, because we know, for all the paucity of literature, there is a lot of evidence that if you get it right, you can radically improve the quality of life of people. And I guess that was a major theme, wasn't it, repeated through what Chris said, that how often, if you get it right for a particular person, it can absolutely transform their quality of life. And that's certainly true here. Many of the people who are least amenable to treatment generic guidelines that would nudge you in the direction of say, well, this could be good if, or this probably won't work if. And so here we have, what are the factors that would favour considering using mechanical devices? What are the factors that would discourage? And you can see that in terms of favouring use, well, the incontinence needs to be predominantly stress. You need good manual dexterity and so on and so forth. But a major one there would be that the device concept is acceptable. And for many, many women, that's just not there. They don't find it acceptable. But nevertheless, this is possibly a good line for a minority of people if they can be properly identified. What about in the pads area? Well, there's a more extensive literature, well, actually a similarly extensive literature there, but less of a diversity of products maybe. We can divide them into these four basic groups. So the disposable insert pads that were designed specifically for this end use, but a lot of women actually buy menstrual pads. It's much easier to queue up in a chemist with a pack of menstrual pads under your arm than with a pack that has incontinence written down the side of it. And so it's well known, actually, that the market for menstrual pads is about 30% bigger than it ought to be. And this is widely interpreted as being because incontinent women are buying them instead of pads. So they're commonly used. You can also get washable pants with an integral absorbent panel in them, and also washable inserts. So what about these four? Well, there's a number of studies been done. There's been a Cochrane systematic review. The biggest study actually was one that Mandy Fader and I published in 2008, where we looked at these products together. But we also asked the 100 or so women who were involved in here, well, what do you want your pad to do day and night? And this is what they came up with, perhaps not very surprisingly. The right at the top of the list is, I'd like my pad not to leak, please. Well, it's comforting to find that we knew that already, but there's the evidence. They wanted it not to smell, they wanted it to stay in place, and so on and so forth. All the things that you would, I imagine, would guess. Slightly different day and night, but otherwise rather similar. Interestingly, if we take that top one and we look at leakage performance, well, how do these four product designs compare? Now, let me just take you into this graph a little bit. On the left axis, we have the probability of a pad not leaking. So 1 means never leaks, so that's wonderful. 0 on the bottom of the scale down here means guaranteed disaster. So it certainly will leak. So 1 is good, 0 is bad. And if a pad were perfect, then the graph would be at 1 all the way across. However much urine you put into it, 1. Perfection. So you can see on that basis that the disposable insert's is really pretty good. And below that comes the menstrual pad, below that comes the washable pad, and below that the washable insert. Quite a spread. So you would think everybody would want to have the disposable insert. And that's true to an extent. Here is what the people thought. So the first choice of most of them was disposable insert. Well, I don't think you find that surprising on the basis of the graph that I've just shown you. More surprising, however, was we said to them, what about if we look not at what would be your favourite, what would be acceptable? What could you live with if you had to? And the answer was rather different. So, unsurprisingly, disposable insert, yes, but look at the way menstrual pad and washable pad are lifted to 60 or 80% acceptable if I'm at home. Not if I'm out, but if I'm at home, so if something goes wrong, I can do something about it pretty quickly. And this has actually opened up for us an interesting line of research of looking at the potential for mix and match. What about containing costs by, for example, 3/4 of the mix of products I get being adequate, and I can use them at home, and the other quarter being more expensive and better, and I use those when it really must not leak? And this might be a way of balancing cost with product effectiveness. And we're just looking at setting up some pilot studies to see whether that would work in practice. Great idea in principle, I think. So if I try to gather together from the studies what we can see about these different designs, this is what we've got. Now, there are a number of slides I'm going to show you like this, and there isn't time to go through the detail, but I think the slides are going to be available on the CFA website, so you might want to return and look into the detail a little bit. But you can see that although primarily disposable inserts is where people are at, there are pluses and minuses to the other categories as well. and not everybody is the same. Now, there's a revelation for you. But really looking at a proper assessment, a proper priority assessment as well, is the way to go.